Hello, my name is John Polvi, and I will be giving this presentation on Fourier domain optical coherence tomography for BME 195. To begin, optical coherence tomography is a medical imaging modality able to take cross-sectional images of tissue, and it is most commonly associated with imaging of the eye. There are multiple types of optical coherence tomography, or OCT. Time domain OCT is referred to as first generation OCT, and Fourier or frequency domain OCT is referred to as second generation OCT. Fourier domain OCT is further categorized into swept source and spectral domain, which I will go more into detail later. OCT has become used increasingly more frequently in the past 15 years due to its ability to obtain high-resolution images with high detection sensitivity and posing little to no risk to patients. Here on the right, you can see a typical OCT machine used in ophthalmology. Going on to history, OCT is a relatively new imaging technique, first introduced in 1991 by David Huang at MIT. Huang's machine took several minutes to form a two-dimensional B-scan image, which was composed of 100 one-dimensional A scans. Huang's design was improved in the following years, including the use of fiber optics, which increased speeds by 100 times, allowing for decreased imaging time, as well as reduction in the size of OCT machines. Since then, second-generation OCT has been further developed to increase speed and sensitivity through frequency domain detection methods such as swept source OCT and spectral domain OCT, which typically perform about 25,000 to 80,000 A scans per second. OCT is most prevalently used in the field of ophthalmology in order to provide real-time data on function and structure of the eye. OCT can provide high-resolution 3D images of tissue structure very quickly to gauge conditions such as macular degeneration or chorioretinopathy. OCT is used for diagnosing diseases, assessing disease progression and response to therapy, as well as helping to understand disease pathogenesis to steer new treatment development. On the right, you can see OCT fundus images as well as retinal nerve fiber layer thickness maps acquired with Fourier domain OCT. Second-generation OCT development was motivated by limitations of time-domain OCT, primarily slow imaging speed. Time-domain OCT involves a moving reference mirror to get depth data. However, Fourier domain OCT eliminates this, providing very high imaging speed with higher sensitivity and axial resolution of 5 to 6 micrometers. Additionally, time-domain OCT would require balloon occlusion in proximal vessels to ensure the image is not distorted by blood, but this is not a requirement in Fourier domain OCT, thus it is non-invasive. Lastly, Fourier domain OCT allows for three-dimensional images due to speed of imaging, as it would be too time-consuming to generate 3D images with time-domain OCT. To understand Fourier domain OCT, first it is important to understand low-coherent interferometry, which OCT is based on. Time-domain OCT has a fairly simple setup, using low-coherence interferometry to obtain A-scan intensity profiles. In interferometry, light is emitted from a broadband light source and travels through the beam splitter, resulting in two paths called the reference arm and the sample arm. The light from these paths is then reflected back and combined at the detector. When the light hits the detector, there are rapid changes in intensity, called interference, which is used to measure the relative distance traveled by the light, as the light was emitted in phase and returns to the detector slightly out of phase due to the two arms traveling different distances, creating interference. This interference is used to measure the sample structure as a function of depth. Coherence length is important in this setup because it has a direct impact on the interference produced. For differences in path length greater than the coherence length, phase relations between two different rays become random. Thus, coherence length on the scale of millimeters provides very detailed images on the scale of micrometers. On the right, you can see a drawing of the basic setup of interferometry, and the graph showing intensity as a function of depth. For time-domain OCT, the depth data comes from a moving reference mirror to record intensity at different locations, but for Fourier domain OCT, the interference is recorded as a function of the frequency of light. The interference detected varies between wavelengths of light emitted by the light source, so knowing the wavelength of light emitted allows for simultaneous collection of data at all depths on the sample. As seen on the right, there are two ways to accomplish this. Spectral domain OCT, where the light source emits many wavelengths and measures them simultaneously using a spectrometer, and swept source OCT, where the source sweeps through a range of wavelengths, and spectral interference is associated with when that specific wavelength was emitted. Spectral domain OCT has a powerful sensitivity advantage over time domain detection because it essentially measures all echoes of light simultaneously. Swept source OCT uses an interferometer with narrow line width, frequency swept laser, and detectors to measure interference versus time. The laser frequency sweep essentially labels different time delays, which are then detected by interference. Swept source OCT has the advantage that it does not require a spectrometer and line scan camera. Swept source OCT can operate at long wavelengths, achieve faster imaging speed, and longer imaging range than FD-OCT, as spectral domain OCT is only capable of penetrating around 2 millimeters. Both of these measure interference based on frequency rather than depth, allowing for much more data to be collected on the sample structure simultaneously. As previously mentioned, OCT is primarily used in ophthalmology, as it is often used to take choroidal images of healthy and diseased eyes. This allows screening for conditions such as age-related macular degeneration by looking for thicker choroid as compared to healthy eyes, as well as screening for central serous chorioretinopathy, diabetic retinopathy, intraocular tumors, and inherited retinal diseases. Choroid is thought to be involved in the pathogenesis of retinal disease, but until the development of spectral domain OCT, it was not feasible to image this. Furthermore, longer wavelength OCT systems, including swept source technology, can help detect subtle microstructural changes in chorioretinal disease. OCT can also be used for cardiac imaging applications such as detection of atherosclerotic plaques and thin cap fibroatheromas, as OCT offers clear luminal imaging of the coronary vessels, allowing for reference measurements for minimal lumen area, as well as identification of lipid pools and internal and external lamina. In contrast to intravascular ultrasound, where significant shadowing effect makes identification difficult, calcium deposits can also be recognized with OCT. Lastly, OCT can be used for neuro-ophthalmic and neurological disease diagnosis such as multiple sclerosis and neuroretinitis. On the top right, you can see OCT images of atherosclerotic plaques, rupture, and erosion, followed by OCT images after stenting in the location of the plaque. In the bottom right, you can see OCT images of intraretinal cysts on patients with age-related macular degeneration. There is still room for improvements in OCT, so let's talk about future directions. As technology improves, it is expected that swept source OCT will become even more powerful, particularly by the use of longer wavelength light to reduce attenuation and scattering, and provide better resolved images of the choroid-sclera interface, which is important for imaging diseases such as central serous chorioretinopathy, because it is associated with thicker than normal choroid. Doppler OCT is expected to increase OCT capabilities in terms of analyzing blood flow and vascular structure, as it can highlight vessels where the flow is present and evaluate vascular abnormalities. Lastly, on-face imaging can provide 3D visualization and understanding of subtle pathological features in the retina and choroid in diseased states by providing more physical context to images. In summary, Fourier domain optical coherence tomography allows for high-resolution images of tissue structures over a variety of applications by using low-coherence interferometry to measure relative distances in a sample. First-generation OCT was slow, so second-generation Fourier OCT was introduced to measure interference with respect to frequency, allowing for vast amounts of interference data to be gathered very quickly. Fourier domain OCT is used in ophthalmology, cardiology, neurology, and neuro-ophthalmology. Fourier domain OCT is very powerful and versatile, however is primarily limited by a lack of penetration depth. Here are my sources, and thank you for listening. Have a good day.